Have you ever been absolutely fine, fully aroused, things are going brilliantly, and then the second the condom goes on, your erection fades like someone switched the power off? That can feel humiliating, confusing, and honestly, a bit unfair because you were ready a moment ago. And if it's happened once, it can start happening again simply because you dread it. But here's the truth. Nobody says out loud, this is incredibly common. It's usually explainable, and in many cases, it's very fixable with a few practical changes. Today, I'm going to explain why this happens in plain English, what your nervous system is doing in that exact moment, the most common condom mistakes that quietly sabotage erections, and the simple ways to keep arousal steady without making condom use awkward or clinical. And stay with me, because later I'll share a discreet 30-second rescue you can use the moment you feel yourself fading, plus a 1-week plan that helps you retrain your body so this stops becoming a recurring pattern. Welcome back. My name is Victoria Bashford, urologist, and on this channel we talk about men's health with warmth, clarity, and zero shame. If this video helps you, do give it a like, leave a comment telling me whether this happens with every condom or only certain types, and subscribe for more straightforward guidance. Now here's your first micro hook. In a moment, I'll tell you the single most common reason erections drop the instant a condom appears. And it's not you don't like condoms, and it's not you're not attracted. Let's start with the real mechanism, because understanding takes the sting out. An erection is primarily a blood flow event. When you're aroused, your body releases nitric oxide, which is a tiny chemical messenger that tells blood vessels in the penis to relax and widen so blood can flow in. The penis then traps that blood by compressing the veins, helping you stay firm. But that system depends on your nervous system staying in a calm, connected state. The second your brain flips from pleasure to monitoring, your body can shift into the stress gear. And stress gear, even mild stress, is not erection-friendly. Quick question. When the condom comes out, do you suddenly start thinking, don't lose it, don't lose it? Because that thought alone can change your breathing and muscle tension in seconds. And in a moment, I'll show you why that one mental shift can be enough to soften you even if your desire is still strong. Here's what often happens right when the condom goes on. There's a pause, there's a task, and there's a tiny performance test. Your brain goes from sensation to doing it correctly, and that pulls you out of arousal and into control mode. Control mode activates the sympathetic nervous system, which is your body's alert system. Sympathetic nervous system simply means the part of your wiring that prepares you for action under pressure. It increases adrenaline, which is a stress hormone that helps you respond quickly, and adrenaline tends to tighten blood vessels. Tight blood vessels mean less inflow, less trapping, and a softer erection. It's brutally simple physiology. It doesn't mean you're anxious in a dramatic way. It can be a subtle flicker of pressure. Hurry up. Do it right. Don't mess this up. And stay with me, because next I'll explain why the pause itself is a bigger deal than most men realize, and how to remove that pause problem without skipping safe sex. Pattern interrupt. Imagine this for a second. You're in the moment, you feel connected, then you reach for the condom, the lighting changes because you're looking down, your hands are slightly clumsy because you're excited, you fumble the wrapper, and you hear your own inner critic go, "For God's sake." That tiny frustration is enough to pull you into your head. Be honest, has that happened? If it has, you're not alone, and the solution is not try harder. The solution is to make condom application feel less like a test and more like part of the flow. In a moment, I'll show you the simplest way to practice that so your body stops treating condoms like an alarm bell. Now, the second big reason is purely physical. Sensation changes. A condom reduces direct friction and reduces warmth. For some men, that reduction is small and irrelevant. For others, especially men who rely heavily on a specific type of stimulation, it's enough to drop arousal below the threshold needed to maintain firmness. Think of arousal like a dimmer switch rather than an on-off button. If you were at 70% arousal and the condom drop sensation by 20%, you might still be fine. But if you were at 55% arousal because you were tired, you'd eaten a heavy meal, or you'd had a drink, that same 20% drop can take you below the line and you soften. Rhetorical question. Does this happen more often late at night, after alcohol, or after a stressful day? Because those factors lower your baseline arousal before the condom even enters the story. And in a moment, I'll tell you the easiest way to raise your baseline arousal safely so the condom doesn't tip you over the edge. Before we go there, we need to talk about condom fit because this is the most overlooked practical issue. A condom that's too tight can literally restrict blood flow, not in a dramatic danger way most of the time, but enough to make it harder to maintain an erection, especially if you already have slightly reduced vascular reserve. Vascular reserve simply means how much extra blood flow capacity your body has when it needs it. If you feel a strong squeezing at the base, if the tip feels overly compressed, or if you notice your penis starts to feel cool or slightly numb, that's a fit problem, not a masculinity problem. On the other side, if a condom is too loose, it can slip. You lose confidence, you start monitoring, and the nervous system alarm goes off again. Quick question. Have you ever avoided buying different sizes because it feels embarrassing? If yes, you're not the only one, but it's also one of the most fixable reasons this keeps happening. And stay with me, because next I'll explain exactly what too tight looks like in the body and what to do about it without making it a big ordeal. Here's what too tight often looks like. You're hard, condom goes on, and within 30 to 90 seconds you feel pressure building. You feel less sensitivity, and then you soften. Sometimes men describe it as, my erection feels trapped, or it starts to throb in a bad way. That's a mechanical clue. The practical tip is to experiment with different condom widths, not just lengths. Width matters more for comfort and blood flow. Also, different materials feel different. Latex is common, but there are non-latex options such as polyisoprene or polyurethane. Those are simply different types of flexible materials, and some men find they transmit warmth and sensation differently. If you've ever had itching, redness, or irritation after condoms, that could be a latex sensitivity. Latex sensitivity simply means your skin reacts to latex, and irritation can absolutely interfere with arousal and comfort. In a moment, I'll tell you the one lubrication mistake that makes condoms feel tighter and less pleasant, even when the size is technically correct. That mistake is dryness, or using the wrong kind of lubricant. Lubricant reduces friction, which can make sex more comfortable and can actually help maintain erections because you're not relying on intense friction to stay stimulated. But if you use oil-based products with latex condoms, you can weaken the condom. Oil-based means things like coconut oil, baby oil, or petroleum jelly, and with latex, that's a safety issue. Water-based or silicone-based lubricants are generally condom-friendly, and many couples find that adding a small amount of lube inside the tip of the condom and more outside can improve sensation and reduce that rubber feeling. I'm saying small amount inside because too much can increase slipping, so it's about balance. The key takeaway is this: many men blame condoms when the real issue is condoms without enough appropriate lubrication. Now here's a micro hook. In a moment, I'll give you a simple, discreet condom routine that keeps sensation high and keeps your erection steady without killing the mood. Pattern interrupt. A quick mini story. Anonymized. I once spoke with a man in his late 50s who said, "Doctor, I'm fine until the condom, then it's like I'm suddenly 90. He thought it meant something was fundamentally wrong. When we unpacked it, he was using a very tight condom type because he was terrified of slippage. He wasn't using any lube, and he was rushing the application while holding his breath. 3 small changes later, the problem reduced dramatically. Not perfect overnight, but enough that his confidence returned. And once confidence returned, the body stopped treating the condom as a threat. That's the part men rarely appreciate. Confidence is not just mental, it changes your physiology. And in a moment, I'll show you how to get that confidence back without relying on hoping for the best. Let's talk about the interruption problem more directly because it's huge. Many erections fade simply because stimulation stops while you put the condom on. That's not a defect, that's normal. Some men maintain erections with minimal stimulation. Others need a steady stream of touch, movement, or mental focus. If you stop everything, look down, fumble, and go quiet, arousal dips. The practical solution is to keep stimulation going during application. That can mean your partner helping, or it can mean keeping kissing, touching, and breathing steady rather than turning it into a silent task. Rhetorical question. Have you ever felt you had to do it alone quickly because you didn't want to make a fuss? That secrecy often increases pressure. If you're with a partner you trust, involving them can transform the moment from uh-oh to we're doing this together. And stay with me, because next I'll give you language you can use that feels confident rather than apologetic. You can say something simple like, come closer a second, or help me with this, or even, I like it when you put it on. You don't have to announce anxiety. You're framing it as intimacy, and that matters, because the brain responds to meaning. If the condom moment means test, you trigger stress. If it means continuation, you stay in arousal. Another practical trick is to open the condom wrapper earlier, somewhere nearby, so you're not wrestling packaging at the critical moment. This is not unromantic, it's sensible. You preheat the oven before cooking, don't you? Now here's another micro hook. In a moment, I'll explain why some men go soft specifically at the moment the condom touches the tip, and it's more about sensation and reflexes than you might think. Some men are very sensitive at the glans, which is the medical term for the head of the penis, meaning the rounded tip. Sensitive here can mean pleasurable sensitive, but it can also mean the sensation is so different with a condom that it feels slightly numb or slightly odd, and the brain interprets odd as not arousing. That interpretation can be instant. The fix is often surprisingly simple. Choose ultra-thin condoms, use appropriate lube, and practice with that specific condom outside of sex so your brain learns. This sensation is normal and still pleasurable. Practicing sounds unsexy, but it's how the nervous system learns. Think of it like wearing a new pair of shoes around the house before a long walk. And stay with me, because in a moment, I'll give you a 1-week training plan that takes less than 2 minutes a day and can dramatically reduce condom-related erection loss. Now we need to address the mental loop that makes this problem snowball. After 1 or 2 experiences of going soft with a condom, many men start anticipating failure. Anticipation changes your body before anything even happens. You become vigilant, you hold your breath, you tense your thighs and pelvic floor. Pelvic floor means the sling of muscles under your pelvis that supports urinary and sexual function. When it's overly tense, it can interfere with smooth erection maintenance for some men. Also, breath holding or shallow breathing can lower carbon dioxide too much, which can make you feel more alert and anxious. Carbon dioxide is not just waste. It helps regulate blood vessel behavior. So the condom moment becomes a trigger for a whole body stress response. Quick question. Do you notice your heart suddenly pounding right as you reach for the condom? That's the sympathetic surge. And in a moment, I'll show you the fastest way to interrupt that surge quietly without stopping everything. Here's the discreet 30-second rescue. The moment you feel yourself fading, do 1 long, slow exhale. Soften your jaw. Drop your shoulders. Then take a gentle inhale and another slow exhale, slightly longer than the inhale. The longer exhale nudges your parasympathetic nervous system, which is your calm, restorative gear, back online. You are not doing a breathing class. You are simply telling your body, we're safe. Then reintroduce stimulation without rushing. This is important. The enemy is hurry. Hurry makes you monitor. Monitoring makes you tense. Tension makes you softer. If you slow down for half a minute, many men find firmness returns. And even if it doesn't fully return, you've prevented panic from turning this into a bigger issue. Now stay with me, because next I'll explain a common condom mistake that can physically knock an erection down. Incorrect application and trapped air. If a condom is put on incorrectly, it can feel uncomfortable, too tight, or awkwardly pulling. Trapped air at the tip can create an odd sensation and reduce sensitivity. Also, rolling a condom on the wrong way and then flipping it can transfer pre-ejaculate, which is fluid that may contain sperm, to the outside, and that affects effectiveness. So correct application matters for safety and comfort. The practical tip is to practice applying the condom correctly in a calm setting, not in the high-pressure moment. Practice once or twice alone so your hands know what to do automatically. That reduces fumbling and reduces the pause. If you're thinking, "Isn't that ridiculous?" I promise you it's one of the most effective confidence builders because it removes the task anxiety. And here's another micro hook. In a moment, I'll tell you why some men lose erections with condoms because of a deeper issue, and why the condom is simply the moment it becomes obvious. Sometimes the condom isn't the cause. It's the tipping point that reveals borderline erectile function. If your erections are already a bit less stable because of age, stress, fatigue, alcohol, diabetes, high blood pressure, high cholesterol, or smoking history, then the condom's reduction in sensation and the brief interruption are enough to push you below the threshold. This is why the same man might be fine without a condom but struggle with one, and then gradually start struggling even without one. It's not that condoms cause ED. ED means erectile dysfunction, which simply means difficulty getting or maintaining an erection firm enough for sex. It's that condoms expose the reality that your system needs stronger support. If you're noticing weaker morning erections, or erections fading in other situations too, it's worth a proper health check. Erections can be an early signal of vascular health, meaning blood vessel health, because penile arteries are small and show changes earlier. And just to be safe, if you ever have chest pain, sudden severe breathlessness, fainting, or symptoms that could suggest a heart attack or stroke, seek urgent medical help immediately. Now, with that said, stay with me, because next I'll give you a practical condom plus blood flow approach that helps many men over 40 and especially over 55. The approach is to reduce the number of arousal reducers happening at once. If you know you're using a condom, stack the deck in your favor. Avoid heavy alcohol, avoid a huge meal right before sex, and give yourself enough time so you're not rushing. Add lube. Choose the right fit. Use an ultra-thin material if sensation is your main issue, and keep stimulation going during application, rather than stopping everything. Rhetorical question. If you were trying to light a fire, would you pick wet wood on a windy night, or would you make it easier for yourself? You're doing the same here. Make the conditions favorable, and your body responds better. And in a moment, I'll show you how to pick the right condom type without turning it into an overwhelming shopping mission. Most men do better when they test 3 variables one at a time. First variable, thickness, such as standard versus ultra-thin. Second variable, width, because comfort and blood flow matter. Third variable, material, because latex versus non-latex can feel very different. Don't change all 3 at once or you won't know what helped. Choose one brand or type for a week, see what happens, then adjust. Also consider condoms designed for more sensation versus those designed for delayed ejaculation. Some condoms contain mild numbing agents to reduce sensitivity, and those can absolutely make erections harder to maintain for men who already struggle. If you've accidentally bought those, it can feel like your body is betraying you. So do check the packaging and avoid numbing types if maintaining firmness is the issue. Now here's another hook. In a moment, I'll tell you the surprising role of foreplay length and why longer is not always better when condoms are involved. Foreplay is important, but if foreplay becomes long and very intense and then stops abruptly for the condom, some men experience a sudden arousal drop. It's like revving an engine and then slamming the brakes. A practical solution is to make the condom part of the foreplay earlier, rather than waiting until the last possible second. That could mean putting it on when you're very aroused, but before you're at the absolute peak, so you don't experience a sudden peak to pause drop. Another option is to keep foreplay steady and sensual, rather than escalating to a frantic intensity that's hard to maintain through any interruption. Quick question. Do you tend to rush to penetration the moment you're hard because you're afraid you'll lose it? That rushing can actually create the very pressure that makes you lose it. In a moment, I'll show you how to slow down without feeling like you're wasting your erection. Pattern interrupt. Do this with me now as a quick body check. Unclench your teeth. Let your tongue rest. Drop your shoulders. Notice if your belly is tense. Many men hold their belly tight without realizing, and that bracing can go all the way down into the pelvic floor. Now take one slow exhale. If you felt even slightly calmer, that's your nervous system shifting. Practice this once a day for a week, and you'll be able to do it automatically in bed without thinking. Now stay with me, because the next part is about partner dynamics, and it can make a dramatic difference. If you're worried about going soft with a condom, you might start acting odd right as you reach for it, getting quiet, turning away, rushing, or apologizing. Partners often misinterpret that as rejection. Then you feel worse, and the pressure increases. So a calm, confident script helps. You can say, "I want to make this feel good for both of us," or "Give me a second, I like doing this properly," or "I like it when you're close while I do this." You're not announcing a problem, you're narrating connection. Practical tip: keep condoms and lube accessible so you're not searching drawers, because searching breaks the mood and increases monitoring. And here's your micro hook. In a moment, I'll give you the 1-week plan I promised that retrains your brain-body response, so the condom moment stops being a trigger. Here's the 1-week plan, and it's deliberately small so you'll actually do it. Day 1. Buy 2 condom widths to test and 1 ultra-thin option, plus a condom-friendly lube. Put them somewhere easy to reach. Day 2. Practice opening the wrapper quickly and calmly without rushing just once. Day 3. Practice applying a condom correctly when you're alone, in a relaxed moment so your hands learn the motion and you remove the fumble fear. Day 4. Repeat, but add a small amount of lube and notice the sensation difference. Day 5. Practice the 1 long exhale reset right after application to train your nervous system to stay calm when the condom goes on. Day 6. If you're with a partner, involve them lightly, kissing, touching, or letting them help, so the condom becomes part of intimacy rather than a break. Day 7. Review what improved most. Was it fit? Was it lube? Was it reducing the pause? Or was it the breathing reset? That review matters because you'll keep what works and drop what doesn't. Viewer participation prompt: if you try this, comment "condom reset" and tell me which variable made the biggest difference for you. And stay with me, because there's one more crucial point: when to stop troubleshooting condoms and get a medical check. If erections are consistently weak even without condoms, if you rarely have morning erections, if the problem is getting worse over time, or if you have risk factors like diabetes, high blood pressure, high cholesterol, or smoking history, it's worth speaking with your GP or a urologist. Sometimes the condom moment is simply where the body shows you it's operating close to the edge. And that's not failure. It's a nudge to check your cardiovascular health and metabolic health. Metabolic health means how your body handles blood sugar and energy. Also, medication side effects can play a role, including some blood pressure medicines and antidepressants. Do not stop any medication on your own, but do discuss it if timing matches symptom changes. And remember a critical safety note. If you use erection medications like PDE5 inhibitors, which are tablets that help blood vessels stay relaxed, they can be very helpful for some men, but they must be used safely and are not compatible with nitrates, which are chest pain medicines, because the combination can dangerously lower blood pressure. Now here's a final micro hook before we wrap up. In the next video, I'll explain the silent habit that makes erections less stable during sex, even when you feel mentally fine, and it's something most men do every day without noticing. Let's bring this home with a clear, kind summary. If your penis goes soft right when the condom goes on, the most common reasons are a sudden shift into performance monitoring, a brief loss of stimulation, a change in sensation and warmth, fit that's too tight or too loose, dryness or the wrong lubricant, and the anxiety loop created by previous experiences. The fixes are practical and surprisingly effective. Improve fit. Try ultra-thin or different materials. Use condom-friendly lube. Reduce the pause by preparing the wrapper. Keep stimulation and connection going during application. Practice the motion so your hands don't fumble, and use a quiet, long exhale reset to stop the sympathetic surge. And if the issue is happening across the board, don't just blame condoms. Use it as a sign to check overall health. If this video helped, please like, comment, share, and subscribe, because it helps other men find calm, useful answers instead of shame and misinformation. And remember, safe sex shouldn't cost you confidence. With the right tweaks, it doesn't have to. Stay healthy, and we'll see you in the next video.